Hi guys, welcome back to my channel. Thank you so much for coming back. Today we're going to continue our conversation on character pathology, but I'm going to highlight a little bit more of an intensive kind of character pathology, and this is going to be our final video on this topic before I go live later in the month and before we switch gears and go into a new topic for the month of June. So let's not waste any time. Let's jump in. Thank you so much for coming back to my channel. For all of you who are subscribed and participating, and for those who are new, I encourage you to hit that subscribe button right over here so that you can stick around with us and be part of our growing and validating community. And in case you don't know who I am, let me briefly introduce myself. My name is Tamara, and I'm an internationally and board certified trauma therapist, but I'm also licensed in mental health, and I specialize in treating children, teens, and families, as well as adults. Let's jump in. So, for the past couple of weeks, I've been talking about character pathology and some of the things that you're likely to see. And, in this video today, I'm going to highlight some specifics, and I want to focus more on the dramatic, emotionally intense kind of character pathology that you're most likely to see. You're more likely to see that than narcissistic tendencies and sociopathy. And the, particular disorder that I'm kind of highlighting in this video would be the avoidant personality, the borderline personality, and the avoidant personality. Now, these particular disorders can sometimes be hidden very well because it's hard to determine, if this person is manipulating, because the behaviors of this person is so consistent and pervasive and chronic, and it can sometimes feel like it's happening at the wrong time or at a methodically chosen time. If you have somebody with borderline personality disorder in your family, or somebody with narcissistic tendencies or avoidant or dependent, sometimes it feels like they manipulate purposely and intentionally. Their goal is to control and to take possession of what they feel is theirs. But, even though it may feel that way, it doesn't necessarily mean that that's what's happening. Sometimes these individuals truly are emotionally and psychologically dysregulated. And I'm talking more so about borderline personality, avoidant, and dependent, okay? Those are the three diagnoses that I'm kind of zoning in on in this video. And I'm going to specify a particular characteristic and symptom that you most likely see, and that is suicidal behavior. And I'm going to break that down for you because sometimes individuals with a character pathology end up displaying suicidal tendencies, and it's really hard to figure out what is going on, and sometimes you can feel manipulated by that suicidal tendency or behavior or gesture as well. So I want to highlight a couple of thinking errors that they tend to have. Here's a definition of thinking errors right over here for you. And then I also want to highlight their clinical presentation, and then I'm going to zone into suicide. So let's jump in, okay? So, let's just jump into the clinical presentation. When someone comes into the office and, they're here for an assessment, for an intake, and, they need to be assessed and evaluated to determine, if counseling would be appropriate for them, if medication, if treatment would even benefit them, they exhibit a clinical presentation. And that clinical presentation tends to include a couple of things that masks the true issue. The first thing that tends to mask the real issue is a pleasant mood and affect. Now, affect is defined as kind of like the emotion that you wear on your face. And a lot of times clinical psychotherapists or providers, we look at affect because we need to know what is your face displaying and exhibiting to us so that we can better understand your needs. And sometimes an individual with a personality pathology is really good at hiding their emotions, and they can hide their affect and appear pleasant and appear bright and appear happy when the reality is on the inside they are barely making it. They are suffering emotionally and psychologically. All right, so that's the most important clinical presentation that we're looking for, that mood and affect. We want to know, how are you really feeling? And then how are you displaying the emotion on your face? Okay, the next part of the clinical presentation is prosocial behaviors. Now, individuals with character pathologies can do a really good job at feeding you everything that you want to hear, and they have a really intelligent and methodical way that they can sometimes mold themselves to come across as to the provider, right? So an example of this would be, I think I'm going to go to therapy today and dress like a businesswoman and come across as very stoic, mature, and serious-minded. Once you strip all of that, right? Once you strip the displayed or projected prosocial businesswoman facade, then you see that there's a lot of holes and a lot of voids in the individual's life and in their heart and soul. But a lot of people with character pathology really do try to cloak that, and they try to cloak the truth of who they are with prosocial behavior. The next thing that's a clinical presentation would be malingering. Now, some individuals can take a diagnosis from the DSM, study it, see themselves in it, and really take hold of that diagnosis and say that it's them. And sometimes, depending on how emotional and highly influenced the individual is, or how severe their character pathology is, they can actually go to the DSM and steal symptoms and wear it as a badge. And, that's bad because the provider can't tease apart what's real and what's not real, or what's really going on with symptoms, because you've studied it so well and you've applied it to you, that now you've started to act out those symptoms, and now it becomes a malingering situation. So there are a lot of people with character pathology that present clinically with malingering, and they have so many characteristics that they have studied and evaluated and applied to themselves, in a sense self-diagnosed, that it's really difficult for the provider to figure out which way to go. And that can cause a lot of friction in psychotherapy, for sure. The next part of clinical presentation would be manipulativeness, or manipulation, I should say, and methodical control. So there are some people who come into psychotherapy and their clinical presentation is to manipulate and control. That's the only thing they have power over, and that's who they are, right? If this individual has a character pathology, which I talk about right up here, more so those with narcissistic sociopathic tendencies, if you have an individual like that in psychotherapy, the clinical presentation of them is going to be who they always are, which is controlling, strategically trying to figure out how to get over on you, really trying to control your treatment of the therapy, or the treatment of the person in therapy, I should say. Or they try to control what's documented in your files. They try to control diagnoses. They try to sue you over diagnoses. They try to, take you to your ethics board because of diagnoses. Like, they really do dig deep, and their behaviors are so way over the top, very, very dramatic. So another part, again, of clinical presentation of someone with character pathology is just that desire to control and possess and manipulate. All right. The next thing I have here on my list is reputation and work problems. That's going to be a big issue when that individual comes into psychotherapy. You're going to be able to see, if you're a psychotherapist, you're going to be able to see that there's a pattern of work-related and social behavioral problems. And it's not just, I can't get along with my colleagues. It's lying, cheating, stealing, manipulating, the list goes on, deceiving. And that carries over into that individual's social life, and sometimes their family life as well. And so there's going to be patterns there. So when an individual seeks psychotherapy, that's the clinical presentation of the person with character pathology. It's pretty simplified. It's really looking at how many bullet points are you hitting here in terms of personality disorder. And sometimes that individual hits all of the criteria for a personality disorder. And that's when I know, there's something else going on here besides just one particular thing. So let's jump into suicidal behavior. So suicidal behaviors can sometimes happen when the individual with character pathology decides to manipulate, or they have an inability to cope with emotions. And there's 4 particular kinds of suicidal expression that I think you should know about. The first is a suicide gesture. Now, a suicide gesture is not lethal necessarily. It doesn't cause death. Okay. Really what it is it may tell someone that, you're thinking about it, And the gesture is this. You may try to manipulate with a suicidal gesture if you don't get your way, or, the individual feels like they need to control and manipulate the situation. They're going to say, hey, you know what? I just took this whole bottle of pills and I just slipped my wrist. I might need to go to the hospital. That's a suicide gesture. It really is, in a sense, more manipulative than anything else, because the individual does the act and then they run and tell somebody about it, which means intervention is coming. So it's not like it's lethal, because somebody who's really truly bent on taking their own lives, they're not going to tell you that they've done anything, right? They're just going to do it, and that's that. People who engage in suicide gestures will do it, and then they'll run and tell someone, and then boom, there's intervention. So it's really not a suicide attempt at all. And so that's one particular type of suicidal behavior that you're likely to see with someone who has a character pathology. Now, the next thing is suicidal ideation. Now, suicidal ideation is really a fleeting thought, okay? It may have some obsessive tendencies, right, where the thoughts just continue in your head over and over and over, but it doesn't necessarily mean that you're actually going to act on anything. It's a thought, and the thought may be passive. And the thoughts may also pop up during the day, almost like a flashback, but it's more of a intrusive suicidal thought, like I would be better off dead, or I wonder what it's like on the other side, or I wonder what would happen if I just killed myself and I didn't have to be available, or I didn't have to exist. That's a suicidal ideation, a suicidal thought. And there may be some elements of how would I complete this if I decided to go through with it. So you're really kind of cerebral at this point. You're kind of up in your head about suicide. It doesn't necessarily mean that you're going to carry out the act. Now, the next thing does. It's called a suicide plan. Now, the suicide plan is more specific. It's a specific strategy with steps, and it also is a direct statement or a direct behavior. So I'm going to kill myself tomorrow at 5 p.m. on the bridge. I'm just going to jump. That's a suicide plan. Or I'm going to overdose tonight once I put the kids to bed. That's a suicide plan. That's more of the high risk, more lethal, hurry up and call the police, hospitalize the individual kind of category. And sometimes people with personality pathology will attempt this. They will try the attempt, right? It's really a suicide gesture because they might go get intervention. But the suicide plan is, the person with the character pathology engages in the behavior, and you may find them on the floor unconscious, right? Is the act a true act? Could be, because they're miserable and their life has fallen apart. And they have a character pathology that they can't heal, or it could be manipulative in nature, right? They're trying to get over on you and they're trying to get something. So the next thing is a suicide attempt, and that is one of the higher risk categories. It's more of the lethal means, because what happens with a suicide attempt is you're actually going to do what you've been thinking. You're actually going to do what you have planned. And the individual tends to make the plan goal-oriented, right? The expectation of dying is high, and the individual is lethal. They know exactly what they're going to do, and they utilize that as a way to end everything. They don't want to deal with the pain or the sorrow that they experience. They don't want to deal with their collapsing reputation, or they don't want to deal with the embarrassment of a divorce, the embarrassment of going to jail. The list goes on. It really is the end of everything when a person attempts suicide, right? Can a person with a character pathology attempt suicide because they feel despairing? Absolutely. But that despair is not the same despair that you may feel. That despair may actually be the result of a poor reputation developing, of losing custody of a child because of your behavior, being fired and not having the income you're used to. It's a shallow reason behind the suicide attempt. Okay, I'm going to post in the description box below, for the sake of time, some thinking errors that these individuals with character pathology are typically engaging in, and it drives this behavior and it drives manipulation. So I'll post that in the description box for you below. Thank you so much for being with me today. I encourage you to hit the subscribe button and the thumbs up button and the bell button if you want to stick around with us, and if you want to get notifications that I have posted brand new videos. All right, I'll see you in the next video. Bye-bye. Now, what I want you to keep in mind is that personality consists of 3 important things: personality development, cognitions, emotions, behaviors, And when those things collide in an individual who has been born, in an infant, in a baby, that's when you get the development of a character pathology.